Trying to socially distance in the urban sprawl has been difficult, particularly for African Americans, 75% of whom live in US cities. And it's just one of many conditions putting them at higher risk of dying from the virus.
They had public-facing positions that meant that they were more likely to be exposed to the virus. They didn't have the appropriate level of health care to assure that if they did get sick, that they'd be taken care of. And they often returned to homes that were three generations of folk living together, frequently overcrowded.
Black people in the US are nearly 3 times as likely to become infected with the virus as their white neighbours, and nearly twice as likely to die from it.
Those look great. Those are awesome.
Tanya Denise Fields got COVID-19 and, unable to socially distance in her New York City apartment, she quickly passed it to her entire family.
When lockdown began and being in the house with 7 other people, 6 children and my partner, I don't think that the English dictionary has created the words to describe what that felt like.
She lives and works in one of the poorest districts in the country. She runs an organisation in the Bronx that helps women provide for their families, including growing food at an urban farm in the heart of the city. But Field says there's also another reason why her community is more vulnerable to the pandemic.
It is racism and the effects of racism. Stress, and racism certainly is stressful, lives in your body on a cellular level, and that trauma can be inherited by your children. So you are talking about 400 years of racism as a national model in this country, and we are surprised at why Black people are the most vulnerable to any public health issue? It's not surprising to me.
From healthcare to housing, living conditions to work opportunities, those disparities in Black communities exist nationwide. Here in Washington, D.C., data from the mayor's office shows the disproportionate effect the virus is having on communities of colour. Almost 75% of the people who died here are Black. Dr. Fullalove hopes the virus could be the motivation to begin long-term changes in Black communities.
Let's eliminate those pockets of poverty. Let's eliminate those settings and the health disparities that are there. And we're going to do it not so much out of a sense of charity. We're going to do it because if we're going to protect the health of everyone, we need to make sure that the communities that are most threatened are also taken care of.
COVID-19 has further highlighted the inequalities and continuing segregation in American cities, where race can become the dividing line between life and death. Nick Harper, SABC News, Washington.